In recent weeks, Las Vegas has emerged as a COVID epicenter. State officials who had begun to relax restrictions are now talking with a renewed sense of urgency about fighting the virus.
I understand all the risk, and I definitely want to get vaccinated at some point.
Nevada now ranks in the top 5 states with the most new COVID cases in the last 2 weeks. Epidemiologist Brian Labus advises the governor on the virus and says several factors have led to the surge.
Our vaccination rates are low compared to the rest of the country. When you take that, you add the Delta variant to it, you add the fact that people aren't wearing masks and that we're open at 100%, we have the right conditions for people to spread the virus.
It's why some resorts and casinos are again requiring workers to wear masks.
People are a lot more distanced than I thought and anticipated and stuff. People are very respectful.
State health officials now also want folks to wear masks in public indoor spaces. In Los Angeles, authorities are warning people not to travel to Nevada. Labus argues tourists are not the big problem. The state's jump reflects only local cases, and most tourists go home before they can transmit.
We have hundreds of thousands of people come to town every week. They stay about 3.5 nights, and the disease takes a little longer than that to actually develop. So a lot of the people, if they get infected here, would already be home before they were able to spread the disease to others. So that helps keep things a bit under control.
Nevada is betting that it can improve its vaccination rate, especially among 20 and 30-somethings.
We're basically at that point where we're trying to vaccinate people who don't necessarily want to be vaccinated.
To that end, it's pulling out every trick it can, from a lottery with prizes to federal teams coming in. The big worry that the uptick in cases will result in more hospitalizations and deaths in the weeks ahead. Reporting in Las Vegas, Heather Sells, CBN News.